Good, good. So I wanted to talk about where we were in 2020, kind of going into this landscape. And I pulled this recent article from that time frame, January 22nd of 2020, that Sherm had published. And the title was around the 6 benefit trends to watch in 2020. And I thought it was so interesting to set the landscape that, as that new decade began, employee benefit specialists were looking at their expectations for the future and thinking about things like more personalization, moving away from that one size fits all to one size fits loan. They were exploring student loan programs. Were talking about the use of HRAs, holistic well-being, additional resources for millennials. That was kind of the framework of what we were thinking about coming into 2020. And it's so interesting, Kevin, that you mentioned that, we're right at that 1 year marker and what a year it has been for wellness. And so now that we're in the thick of things of 2020, we are living in the largest shift in how we work in our generation. Perks that worked before COVID are now a thing of the past, and employees are really going to need more support from their organizations to help them shift their families, community, and lives into the new normal, or what I like to call the next normal. All of that is happening while employers are feeling this pressure to deliver on great employee experiences that they really know that their employees deserve. And the statistics on the screen, I think, are very telling about where we're at right now. 51% of Americans are working remotely right now. 40% of US adults report mental health or substance abuse struggles. Uh, I'm assuming that those on this call have been in this 40%. As an HR professional, we've been balancing a lot of hats. As business professionals, you've been balancing a lot of hats, as well as trying to understand your own mental health. 1 in 2 employees are now less bothered by office-based perks. So think about all that investment that you had done before in those great office environments, the free snacks and the pool tables and the ping pong tables. We're going to see a shift in that. And then 4 in 1 employer said that their employer is not currently offering benefits or programs that help. So as we go into thinking about what this next normal looks like, we're left with the idea of what does the modern employee want? Not to forget to mention that we've gone through this extreme digitization in the last year. COVID really forced a lot of organizations to quickly pivot to fully remote workforces and to lean into digital tools like they hadn't before. I mean, even for a company like Paylocity that, we had about 55% of our workforce already remote, we went to 98%. We had to rethink communication. We had to go to asynchronous communication. We had to think about how can we provide resources that are going to be beneficial for the employee in the environment they're in and in the makeup they're in. And so as we go forward, some of the things that we're going to have to think about is a holistic well-being approach that addresses 4 key components: mental health, financial health, social health, and physical health. These 4 components are going to be critical for companies to both help their employees manage during crisis and support an organization's recovery. Learning how this approach can positively impact you is going to be huge. And as I think forward, there's a statistic out there that 74% of employees are concerned about at least one of these aspects of their well-being as a result of the virus. We can see this in legislation that's come out for stimulus packages for employees, increases to things like FMLA and leave, and really the measures that you've taken in your organization to be more flexible. We've seen changes in scheduling, we've seen furloughs, we've seen voluntary leave of absences. So it really is a new normal as we think about the boxes that we have to check. So I'm hoping that kind of the time we spend together for the rest of the time I have is we can dig into some of those ways to think about a holistic approach to wellness. So Holistic, right? Whole person. And I think there are so many categories that we haven't dived into enough. So when I think about nutrition, right, I think this has been in the past like, hey, we're going to make sure that we switch from Chex Mix in the office to maybe cheese and meat. I think it's so much more than that. So you're not talking about just snacks in the office. You're talking about classes. You're talking about opportunities for people to come and learn how to cook. Maybe you're teaching people how to meal prep, right? We're all in a busy environment. So knowing how to meal prep for your week could be a big benefit for your employees. Things like time management beyond just how do I manage my schedule, but how do I really dive in and live in a world where work and life is completely integrated, meshed up, intertwined. There's no more work-life balance. Stress management, right? How do I teach employees and give them the skills and the resources they need to manage what's happening in their worlds and in the workforce? Social ties. So we were just talking about this a little bit before we jumped on live. Is students, how are students living right now through social ties, and what does that look like, and how do we help not only our employees now, but as they come into our offices again, right? A lot has changed in a year. Things like sleep habits, disease management, I'm going to go into a little bit more detail. Money management, this is a huge one as we think about millennials and Gen Z coming into the workforce. Some of the things that they're looking for now aren't just um, they're looking for student loan repayment. They're looking for tuition reimbursement. They're looking for how can I take the money that I've invested in my degree and get value out of that in this role? And how are you going to help me pay for it? So again, really diving in to think about a whole person's wellness in all the dimensions is going to be really important in this new normal. And so let's get to the bottom line and talk about ROI on wellness programs. I think so many times these can get a little wishy-washy. So I wanted to ground us in some really interesting data. So when you focus on disease management programs, these are going to be the most impactful. $4 saved for every dollar spent. So these are going to be programs that focus on obesity, diabetes, asthma, cancer, arthritis, depression, sleep apnea. Think about all the things and programs that you can provide for employees that will help in these areas. The other category is going to be lifestyle management. This is the one that we're really going to need to lean into for the future. So these are about reducing health risks, reducing medical and healthcare costs, improving productivity, reducing absenteeism. So think about programs like this would be Hinge Health, if you've ever heard of Hinge Health. So that's a program where you can wear a device, it helps with people with arthritis, and it can give you feedback. Think about it as like personalized PT without the cost. You can do different programs where you're helping with sleep management. You know, we have a program that we use internally at Paylocity called Equilibrium. And it's a whole gamut of mental health resources in this app. But one of the things it has is these sleep meditations. And it's so interesting to think about going to my employer for something that's going to help me not only be more refreshed, but also help everything else in my life if I'm getting the right amount of sleep. And so I would say though, if your focus really is on ROI, and that's going to be the biggest driver for your wellness, you're going to want to lean into those disease management programs first, then build on that momentum to install wellness programs that are going to impact engagement. So the next slide just gives you a little bit of an example of how long it's going to take to see that impact in comparison to a disease management program over a lifestyle management program. And we all know ROI is so important, right? Some of us are dealing with big budgets, some of us have very tiny budgets. So we have to make the most of what we have. So when you're considering these packages, don't expect a high ROI for lifestyle programs. Do you expect high participation? And do you expect high savings on disease management programs? But here's the thing, it's important not to leave the lifestyle programs out of your total wellness strategy. The biggest factor for introducing a lifestyle program is going to be around engagement. So you're going to see that uptick in engagement. And there's a lot of statistics on the screen. I'm not going to read through everything, but engaged employees are involved, they're committed, they're enthusiastic about your organization, they feel positivity impacts their physical health. And we all know that it's going to have benefits to them psychologically. But all that being said, I want to encourage you to think about this anecdotally. So, for example, this morning, as I was getting ready, I took my time. I enjoyed that cup of coffee. I worked out. I read for a bit. And it gave me the ability to come into my day, to my presentation, grounded, focused, knowing I was going to have a more productive day. If you spent that time filling your pitcher and filling your employees' pitchers, they're going to be able to pour that out into the work they do. And so if we can harness that same concept in lifestyle programs, I think we're going to see this dramatic impact in our organization. And lifestyle programs, I think, really need to lean into some of the mental health stuff that we've talked about. I don't have a slide on that, but I know that when we think about mental health and we think about this concept of employee positivity factor, it's going to increase our engagement, but it's also just going to be the right thing to do. We're going to spread positivity. It's going to increase positive attitudes and ideas. It's going to propel your organization to have innovative and brave problem solving. It's going to increase your customer satisfaction scores. And honestly, you're going to see higher discretionary effort from each employee. I know that when we approached our employees with an attitude of care and really leaned into a culture of caring, there was a shift. There was a shift in the feel in our organization. There was a shift in what employees wanted to do. Some of the things that we did early on in the pandemic was use our data to make these decisions as to what programs we needed to implement. So we ran a report to find out how many employees had listed in their benefits records that they have young dependents. We reached out to them proactively to talk about what flexibility you're going to need. What is your situation? Are your schools closing? Are you going to have to balance remote work? And then continue to think outside the box, right? So when you think about these lifestyle factors, it's an out of the box exercise. So next was, okay, now we know that we have kids at home. Do they have computers? Can we do something as an organization? So we had loaner laptops. We created a program around loaner laptops. We created a program around internal tutors that could tutor your own students. And we rolled that into our volunteers in action program. So a lot of this might not be you have to put money up front. It's really about being creative and thinking about the next steps. But if we go back to kind of that parameter I said at the beginning around mental, physical, financial wellness, you might be thinking about, okay, like, where do I even start to find programs like this? These are all great. And I think I have some good ideas on what I could implement, but there's a lot of really great resources out there for free that you probably can already tap into. So when you think about financial wellness, I really encourage you to tap into your 401k provider. So we have Principal here at Paylocity, and what I think is really cool about our partnership with them is they have free education for you as somebody who participates in the program. You can get things about how do I manage my student loans? You can think about how do I plan for my retirement, but very tactically. Sometimes that can be very overwhelming. How do I plan for purchasing a home? How do I become an empty nester? What are the things I need to think about? Medical providers. So your medical provider might have that basic education. They might have some of those discounts to healthcare, but they might also have some of these other programs that I talked about where you can help provide wellness on how you eat. You might be able to provide free access to webinars on different topics. Always use your EAP. I can't say this enough. I think it's a wholly untapped resource for employees. You're going to be able to get free therapy sessions for your employees. And something I learned just recently, so I'd encourage you to look at your plans, is our EAP is designed in such a way that each incident qualifies for 3 free therapy sessions. So if you have an episode or a moment, or you need help on a specific topic and you call EAP, you get those 3 free sessions. If you have something else going on, something different later on in the year, you can still qualify for an additional 3 sessions. So really encourage you to look into that. And then community offerings. This is one that, again, untapped resource. There's probably stuff happening in your community for free that you can leverage. You might have free community resources for your older population that you haven't tapped into. Other things around health and wellness, education. Maybe you don't have somebody in your organization who wants to teach a yoga class, but maybe you can have a couple people in your organization check out the best yoga classes on Amazon Prime and offer those up to your employees and give them time to partake. Developing culture crews, wellness crews to really dig into some of the other options, some of the things that they would enjoy as employees. And then lastly is gig opportunities. So we do this internally. There's a lot of amazing people in our organization that have side hustles in a lot of different ways. So everything from makeup artists who help me get ready for webinars to those that teach yoga or do wellness classes. We just added actually a HIIT workout once a week. So again, sky's the limit. Really think outside the box when it comes to the holistic employee. And then I will leave you with this. Starting today, I think the biggest piece you have is education. Start with educating your leadership on the benefits programs like this will have on the future of your organization. When you can make this switch to a more modern approach, you're going to be able to attract better talent. Think about Gen Z coming into the workforce. They're looking for companies that are holistic in their approach. They're looking at companies that are going to use modern tools. And this ultimately is going to give you the ability to attract, retain, and promote talent differently than you ever have before. And then specifically for those in HR, this gives you the opportunity to be more strategic. You can help to redefine communication. You can focus in on creating curated employee experiences. And I want to talk about that one a little bit before I end, because I think so many times in HR, we have focused on checking the box, right? Can I provide these tactical check boxes to get to the bottom line to help either my business or my employees accomplish something? And the employee agreement, the implicit employee agreement we had with employees used to be, you come to work and I pay you. It's totally different now. Now employees expect you to curate experiences for them, the same experiences they're getting from other companies that they purchase things from as a consumer. So it gives us the opportunity to kind of flip the script and think about what's the experience I want our employees to have. And you're going to see those increases to ROI and things like better Glassdoor ratings, better customer reviews, better customer outcomes, and all of that to end and say that you really do need to connect to modern solutions. So when you're thinking about some of these programs, think about digital first, think about ease of access, think about making sure that you are tying those things into maybe your company values or those kinds of things. So I will end there. I don't know if we have time for questions, if that's something you want to do, but I really encourage you all to think about what's next and helping employees with that holistic experience.
Sherry, thank you. That was great. We do have a couple questions. Somebody, Christine, mentioned that they just expanded their EAP to 5 sessions and it was well received. So I think the importance of EAPs is critical. For MEA members, we have a great partner. They've been our partner for like 30 years on EAP. So if you want to talk with Rob Baldino and his crew, just let your MEA rep know, because they did expand their therapy programs, and it's a very effective, cost effective, because it's done at the company level, not at the per use level, and it's very great. Somebody asked a question. I'd love to get your feedback in terms of, I think we all agree these are great concepts. How do you see effectively doing it when we're virtual or hybrid versus personal? And I know you guys have been virtual for a year. What have you found works to make that easy kind of work for you?
Yeah. Over communication is the first thing I would say. So we've implemented, like I said, we did HIIT programs, HIIT workouts, we've done yoga, we've done special sessions around DE&I. So that was a big concern for professionals this year, and how do you support employees for that? Some of the other things that we did is we looked at the way we were communicating and saying, is this the right way? So if we require that employees jump onto a Zoom and that's the only way they're going to get the information, and we're not being really cognizant of their work life right now. They might not be able to do that, right? So we've created venues where there's asynchronous communication. We will record a video, we'll record an update, and then we'll post it in such a way where you can comment on it and interact with it. We do a weekly executive Q&A where you can submit your questions anonymously and our C-suite will answer them. So I would say communication is key. I would say the second thing is survey your employees. Start there, see what they need, see what is going to be your biggest bang for your buck, either from a lifestyle perspective or disease management, so that you can really hone in on what's going to be of value for your time and for your employees.
That's awesome. And that flexibility, like you were saying, is really listening to your employees. That's great. Someone asked if you had any examples of successful disease management programs, especially with a remote workforce.
Yeah, I would have to look the name of it. I don't remember it off the top of my head, but we actually have a diabetes management program that's been very successful in our organization, really giving those who have been diagnosed with diabetes the right tools, the right resources, things like access to testing strips for cheaper, some of those kinds of things. And we've seen our numbers go down when it comes to medication and those kinds of things.
Well, why don't you, if you could just send us a link for that, then when we communicate out, we'll send that to everybody. And
Yeah.
of course, we'll send it out, the slides and recording. So if anybody wants to share what Sherry talked about with people in your organization, that'll come afterwards. So I think that's it. Sherry, thank you so much. That was great. I appreciate you joining us, and really good things to think about there.